to follow the statement of Hippocrates, he who lived in ancient Greece, basically, we don't just get sick overnight. There's usually a continuation of different events happening throughout our life, maybe even some inherited factors, and then we appear to all of a sudden get sick. However, disease is a constant evolution of process and doesn't happen overnight. So when we use the BodyTalk system approach, as I said before, we don't just want to look at the symptoms, we want to look at the whole person. That means also the story behind the symptom. Why is it there? And the beauty of this is that modern science supports all of that, what we have been working with for a number of years now. So when we talk about that in BodyTalk, we want to improve the communication and the energy flow in the body. We use a muscle biofeedback system, and the questions we're asking is always, what is priority now? Which body area, for example, has to now communicate better with which other body area? And out of this questioning and the priority asking, we're having an automatic sequence. And the sequence for healing and for self-healing is very, very important. And the innate wisdom of the client knows this the best. I cannot see that from the outside often. So when we're asking, it's a very tailor-made session. And so the priorities help us to have a better session. And also, what we have observed is that when we're asking and working like that, it is in the best possible way for the patient. And at the same time, healing crisis or something like that would usually not happen because the innate wisdom wants to heal. It doesn't want to distress itself. In BodyTalk, we have 3 key words: communication, synchronization, and balance. And so the most important is to get the body talking again. That's communication. And the outcome of that is that all the body areas, we can compare the body parts, organs, endocrines, body parts to instruments in a symphony orchestra. And each instrument can be finely tuned, it can be healthy, it can be perfect. But when all instruments come together, it could be that we just hear noise because the conductor of the whole orchestra, the innate wisdom, is not doing a proper job or cannot do a proper job because no one is listening. So with BodyTalk sessions, we're trying to optimize the balance that is experienced. However, we have to understand that the body-mind complex is always in a so-called dynamic equilibrium. And so sometimes when we experience stress factors or pain or discomfort, it could just be that our pendulum of life, which is constantly flowing like this is the yin and yang of life, is just stuck in one extreme position. So with BodyTalk we can help to swing the pendulum to swing back, and then try to be more in the middle so we can just go easily with the flow of life. And so that is very much helpful for our own personal well-being.
So this is coming from the area of body parts general, a specific tissue, skin priority, connective tissue priority, a fat tissue priority, blood, nerve, lymph, a bone. A specific bone. Wonderful, a specific bone. So we're staying in the upper half of the body? No, we're going to the lower half. Lower half is priority. A bone in the area of the pelvis and the back. A bone in the area of the legs. Okay.
Just a short quote from Paul Watzlawick. One cannot not communicate. So that means we're all aware that there's the so-called non-verbal communication. So when we're talking about BodyTalk, obviously the patient doesn't have to say anything, and also in relation to his everyday life, he doesn't have to say anything, but a lot of things can shift. His body language can shift, his outlook on life can shift, his body chemistry can shift. And so the communication also on the non-verbal part, not just within the body-mind complex, can change. The usual approach to healthcare would be to ask the question, what is missing in the person? What is wrong? Where is the problem? Whereas the holistic and specifically the BodyTalk approach is, where can we go from here? What can we, what could our target be? How can we help the self-healing process? So that is very different to the normal usual approach.
So EGB is essential general balancing. That's something very important, which is helping us to stay centered. It balances our brain, hydration, scars, which we may be having. So essential general balancing. What's the priority? SB, switching, cortex, hydration. Scars priority. Okay. Do you have scars on your body? Yeah. Where are they? Somewhere else? On the left. So we're going to ask your body now. Is any of those scars a priority? The scar on the ankle. Okay. Scar on the ankle. That's what the body is telling me. So hydration in that area where the scar is priority. Clear answer, please. Yes, is that priority? Yes. Okay, so we just balanced the scar. So most importantly, the energy has been brought into flow. There's communication happening there, and in order to optimize that location, most importantly, most probably in the cells, we're now going to address this with hydration. So I would have to place that water onto your skin, on your scar. So you can do that yourself. And then place the cotton bud in your sock so it won't fall off when we're doing the session. And so this breathing and tapping is helping your brain to switch on the pathways of communication in the cell and in the scar.
So something you can do for yourself, obviously, to bring order into your own life, into your own health and well-being, is to come for regular BodyTalk sessions. However, there's another tool, a very simple tool you can learn for yourself, and we BodyTalk practitioners feel it is as important as brushing your teeth. That is the so-called cortex technique, which you can see in a separate film, how to do it on yourself. And apart from that, you could also learn BodyTalk Access. BodyTalk Access is something you can do also every day. It takes 5 to 10 minutes. And the idea is to balance your whole body-mind complex with a couple of different and simple techniques, basically geared to balance your brain, to balance your hydration, because hydration is very, very important for all the cells, the metabolism of the cells, the immune system, the energy circulation, the stress management. And then we can also balance, or you could also balance your whole body-mind complex by working through the musculoskeletal system, the organs and the meridians. So it's a very complex technique. At the same time, it's very simple to learn. You just need a day, and then you have this technique and tool for the rest of your life, for yourself and your family. And there's also a fast aid method you could use in case you get injured or you have children that get injured. You could use that, also immediately after the accident. So many people ask me, why should I come to BodyTalk sessions with a certified BodyTalk practitioner? Well, you're asking the wrong person there, because I know from my long years of experience with BodyTalk that BodyTalk just works. It works for myself, it works for my family, my friends, a lot of people whom I have been teaching to, and so forth. So the easiest would be obviously to try it out. It might be confusing to have so many different therapies who all have kind of, it seems, the same message. And what a lot of people also ask me is, have there been any studies that have been done with BodyTalk in the scientific community? Generally, we can say BodyTalk is still part of what we call experiential medicine. However, there have been studies that have been conducted, and they were actually conducted within the lines of the health authorities in the US of A. And so there were great benefits doing BodyTalk, and but still there are very few studies, and we can always say, just try it out for yourself, and like the many thousands of people worldwide, feel, and then you know what BodyTalk is about.